nicotine is not the problem with tobacco smoking. It's the other 7,000 chemicals. And so whether it's nicotine patches or electronic cigarettes that mainly deliver nicotine, these are much less harmful products. And so switching to them is a big step to reduce your health risks. My name's Jonathan Foulds. I'm a professor of public health sciences at Penn State College of Medicine in Hershey, Pennsylvania. What we found was that the nicotine electronic cigarette really did help smokers to quit. 3 times as many quit smoking with the nicotine electronic cigarette versus the placebo. And this was done double blind. What that means is that neither the researchers nor the participants knew whether the e-cigarette they were given contained nicotine until the study was completed, and then we analysed the data. So about 36% quit at 6 weeks on the nicotine versus 11% on the placebo. So it was more than 3 times the effect, which is actually quite a big effect size in smoking cessation studies. Everybody knows that smoking is extremely harmful to health. It's harmful because people tend to smoke for a long time. They don't do it for a couple of weeks and then stop. They almost smoke lifelong, and it's the lifelong exposure to all the thousands of chemicals in cigarette smoke that causes the serious diseases: cancer, lung disease, heart disease, things that cause both premature death but also cause chronic disease like COPD. So switching people away from a harmful product like cigarettes that delivers thousands of harmful chemicals to a product that delivers nicotine with far fewer toxicants is a big step in the right direction. And we think e-cigarettes are likely much less harmful than cigarettes, and so less harmful to health. Electronic cigarettes help smokers to quit in much the same way as nicotine patches or nicotine gum that we're all familiar with. So the person smokes for the nicotine. They're addicted to the nicotine. And so when you try and quit cold turkey, many people do succeed in quitting cold turkey, but most people find it very difficult. So your average middle-aged smoker has already tried to quit at least 30 times and not succeeded. And in fact, many smokers in later middle age have given up trying to quit because they think they can't. An electronic cigarette helps people to quit smoking by giving the smoker the drug they're addicted to, just in a much less harmful way. Electronic cigarettes are not approved as medicines. They're a consumer product. But the idea here is that people who either can't quit with a medicine or would prefer to continue to use nicotine long term, they just rather it didn't kill them, they can purchase a product like an e-cigarette and switch over. And they find it easier to get off the cigarettes because the nicotine is being delivered in a way that's like a cigarette in a way. You're inhaling it. So you continue with the ritual, continue with the nicotine delivery that's inhaled, and smokers are used to that, and they find it easier to switch to an e-cigarette than they do to, say, a nicotine patch. We don't think electronic cigarettes are harmless. So nicotine itself is addictive, and so by using an e-cigarette, you're continuing to take the addictive drug. But we know that nicotine is not the chemical in cigarettes that causes 95% of the harms to health. It's the other 7,000 chemicals. There are 250 toxicants in cigarette smoke. So we know that it's not harmless. Nicotine itself is not completely harmless, but it doesn't cause cancer, for example. And so if somebody has tried to quit many times, and the people in our study had tried to quit at least 6 times already and been unable to quit, if they can step down from 7,000 chemicals to 20 chemicals at a lower level, that's a big improvement to their health. The number one harm from continuing to use nicotine is that it's addictive. And particularly in an inhaled form like a cigarette or like an e-cigarette, the nicotine gets absorbed very quickly. And that's the more addictive way to take it. So if we think of cocaine, we think of crack cocaine as being more addictive, partly because it's inhaled and it goes right into your brain in 15 seconds. However, the nicotine itself, because it doesn't cause cancer, for example, is addictive, and some might argue that some of us, maybe myself, might be addicted to caffeine. Okay, so I don't like the fact that I get a headache if I don't drink a couple of cups of coffee every day, but I don't consider it a major health risk to me. And nicotine itself is not a major health risk. We don't want young people who don't smoke to start using these products. And in fact, you have to be 21 to buy them legally. But these products, we think, can have a useful effect on public health by helping adult smokers who are addicted to nicotine to get off of cigarettes and reduce their risks.